I feel like this only comes around once every 4 years.
Pitchwoman Campbell feels at home in front of the camera.
Then pay no interest for 2 full years.
But when the actress hit her early 40s, she says her slim build took a toll on her face, making her look gaunt and old. But doctors agreed she wasn't a good candidate for a traditional facelift, so Campbell
And we're preparing to do the stem cell facelift.
turned to a new controversial procedure called the stem cell facelift.
Just a few minutes, we'll start the stem cell lift.
Documenting every step as a Beverly Hills dermatologist used liposuction to pull fat from her thigh and inject it into the hollow areas of her face. But what can't be seen is what's described as the secret stem cell harvesting process.
There's a secret procedure that takes place here.
Afterward, Campbell, still swollen, appears happy with her plumper look that she says restored structure to her once sagging face. Still, this has plenty of critics who say calling the procedure a facelift is wrong. There's no cutting or sewing skin. Some believe doctors are taking harvested fat and spinning it in a machine and putting it back, potentially just taking some stem cells along. Really, they say it is fat grafting, which has been around for decades.
It appeals to the fantasy of patients, but is based on no data at all.
Plastic surgeon Bucky says there isn't solid research, only marketing hype surrounding the procedure. He questions whether stem cells are really being used, advising a good dose of buyer beware.
Best case scenario, a patient spends a bunch of money and gets no result. Worst case scenario, a patient spends a bunch of money and not only doesn't get any result, they get a bad result, have a problem that then needs to be fixed.
Here's the problem for consumers. If you do a Google search of stem cell facelift, you'll find that there are lots of doctors doing this procedure. There are even some doctors trying to trademark what they're doing. Well, that's really confusing for consumers. And right now, the peer review is still out on this. So industry analysts are urging caution.
I don't think any of us have the answer to that question.
Austin plastic surgeon Rob Whitfield is concerned that consumers are paying more, $5,000 to $10,000, for a procedure that may not deliver a better beauty fix.
And if you use stem cells as your connection to the fountain of youth and you feel like that's the next best thing to do, that's on us to prove that it does work as physicians and surgeons and not take advantage of people in their ever-ending, never-ending journey to find, a youthful appearance.
Now it lacks by 3 complete rooms of furniture for...
But Campbell is a believer. Within days, she says she was healed and ready for her close-up. But experts say it will take time to tell if this procedure is a gimmick or real medicine. Tongish for the Plastic Surgery Channel.